Hi everyone, and welcome to our presentation on milk thistle. Today we're going to be doing the presentation by running through a series of scenarios where you, the pharmacist, are going to be interacting with your patients. Let's look at patient number 1. She enters your pharmacy and says, "Hi, my friend recommended milk thistle to me to use as a supplement, but I'm not really sure what it's used for." You, the pharmacist, say, "Certainly. Milk thistle can be used for a number of reasons. However, the most common use of milk thistle is as a supplement for liver health." Let's look at this further. Milk thistle is a supplement used to promote liver health. It is thought to have hepatoprotective properties, allowing the liver to flush out toxins. It's important to note that a lot of the studies that looked at this were using the active component of milk thistle, called Silymarin, rather than the whole product itself. It originates from a plant that is native to southern Europe, southern Russia, Asia, and northern Africa. Historically, the fruit and leaves of this plant have been used to treat liver and gallbladder problems for 2,000 years. Where possible, the pharmacist should always provide the patient with written information about the supplement. They should also inform the patient of the level of evidence supporting the claims behind the supplement. This will be explained nicely in our next scenario. Now, a young mother enters your pharmacy, let's call her Jane, and Jane says this: "Hi, I was thinking of using milk thistle as a supplement, but I want to know more about the evidence behind it before I make up my mind." You say, "Thank you for asking. It is important to consider the evidence behind a complementary medicine before choosing to use it." So what is the evidence behind milk thistle? When discussing it, always use the highest quality evidence available, especially when talking to a patient. Where possible, use accredited tertiary sources. However, for medicines with less cohesive evidence available, systematic reviews may be used instead. Now, multiple clinical trials and systematic reviews have been conducted on the safety and efficacy of milk thistle supplements. Trials have shown that milk thistle supplements are generally well tolerated. However, some patients reported a mild laxative effect. Multiple reviews regarding the efficacy of milk thistle found little or no impact on the progression of various liver diseases. And minor studies have shown that milk thistle may have the ability to alter blood glucose levels. While the efficacy of milk thistle supplements has not been proven, research has shown this supplement is safe to use upon consultation with a health practitioner. Now let's return to Jane. Jane says, "Thanks for the information. If I'm currently breastfeeding, should I be using this medication?" You reply with, "There is limited evidence regarding the safety of milk thistle supplements during breastfeeding. Due to this lack of evidence, I would recommend against using the supplement." Now, you can find more information about supplementation and breastfeeding on the RACGP website. Let's turn it up a notch. Now, not all of your patients are going to enter the pharmacy with simple requests, so let's discuss a comorbidity case. For scenario 3, we're going to be talking to John. John says, "Hi, I've been living with hepatitis C for a number of years, but my doctor has recently diagnosed me with something called cirrhosis. Should I take milk thistle with my regular medication to treat this?" You, the pharmacist, reply with, "Milk thistle can be used in conjunction with prescription medication for treatment for liver disease. However, this should be discussed with your physician before commencing the supplement. It's important to note that a lot of milk thistle supplementation in conjunction with liver disease treatment has been used for research purposes only and is not the gold standard." When counselling a complementary medicine such as milk thistle, it's important to note the adverse effects. Now, adverse effects of milk thistle may include gastrointestinal symptoms such as the laxative effect we talked about earlier, headache, fatigue, sweating, itching, and possibly a rash. Clinical studies suggest that the active component Silymarin in milk thistle may interact and have additive hypoglycemic effects. Silymarin may also have estrogenic effects and therefore should be considered with caution in individuals with estrogen-sensitive treatments or conditions. Now, when supplying a supplement to your patient, it's important to know what's available. We've given you some examples here in the Blackmore's brand, the Swiss brand, and the Synovus brand. Now, if you read the fine print at the bottom, you'll notice that all of these products contain slightly varying amounts of the active ingredient, and they may contain other complementary ingredients as well. Now it's time for an investigation. As you know, not all of your patients are going to present to the pharmacy with a cohesive inquiry such as the ones we've looked at earlier. For this, we're going to talk to Derek. Derek comes into your pharmacy and says, "Hi, I would like to buy a bottle of milk thistle supplements, please." You say, "Certainly. Do you mind if I ask a few questions before supplying the medication?" He says, "No, not at all." Now, before I move on, think about what questions would you ask Derek, and feel free to pause the video and think about it if you'd like. But for now, we're going to move on and see what our pharmacist has to say. Your pharmacist says, "Is this medication for yourself?" Derek says, "Yes, it's for me." "Have you used it before?" "No, this is a new medication for me." "May I ask why you're choosing to use this supplement?" Derek says, "Well, I heard that it keeps your liver healthy." The pharmacist says, "Well, do you have any pre-existing medical conditions that we should be aware of?" Derek says, "Only paraplegia, which was caused by an injury 10 years ago." "Are you currently taking any other medications, prescription, over-the-counter or complementary?" He says, "Currently I am taking ibuprofen and nothing else." Lastly, do you have any known allergies? "None that I know of." Based on this information, our pharmacist says, "Thank you for answering. I am happy to supply this medication to you today, but I would advise that regardless of whether you use the supplement, the preferred method of maintaining liver health is by eating a healthy, well-balanced diet and limiting alcohol intake." Now, when supplying your patients with medication, you should always provide lifestyle advice as well as counsel administration and side effects. In summary, milk thistle is a liver health supplement. Its safety is proven, but its efficacy is not. While most patients can take it alongside with their regular diet, there are some patients who require extra consideration before taking the supplement. When counselling for this supplement, always provide lifestyle advice and discuss administration and side effects.